Tonight we'll be giving a presentation on the Sexual Assault Nurse Examiner. I'm Mary Reed.
I'm Carrie Pickett.
I'm Shelley Eliam.
And I'm Wayne Snyder.
This is for Community Health with Dr. Rosenquist. The primary activities of the SANE nurse is to care for post-sexual assault victims. They provide crisis intervention, emotional support, health care, injury detection and treatment, collection of forensic medical evidence. Their scope of practice is in hospital emergency departments and community-based clinics. They offer these services to sexual assault and abuse victims. They provide assessment, treatment, collection of evidence, emotional support, documentation, expert testimony. They're patient advocates, and they provide community resources. Many communities around the country have implemented this, which provides a multidisciplinary victim-centered response.
The educational preparation for a SANE nurse. He or she should be an RN with 2 years of clinical experience and with advanced assessment skills. They should go through SANE training, which is approved by the International Association of Forensic Nurses, which includes classroom and clinical preparation, precepted sexual assault exams. Once they meet all of their guidelines, they can become a certified SANE nurse. You have a SANE A, which is adults and adolescents, or a SANE P, which is pediatrics. And of course, with any nursing profession, we have continued education that we have to do. Teaching and learning strategies. The U.S. Department of Justice recommends using a victim-centered care approach. Sexual assault case is a priority emergency case, and that should be priority should be given to that victim. We should respect their privacy, explain each step in the process, keeping in mind that some of these victims, because they can range from small children to elderly, some of these may have never even had an internal pelvic exam before, so they need to know step by step what's going on. They need to adapt the exam based on the victim's needs. Some of those needs can be based on their age, on their gender, because both males and females are victims of sexual assault. We have to look at their health history, meaning their physical and mental health history, as well as their current health status. Whether or not there's any learning disabilities, whether or not there's a need for language interpreters, if the patient is deaf or blind, make the appropriate accommodations for that. We have to look at their cultural beliefs. Also look at whether or not alcohol or drugs were involved during the attack. Look at the physical injuries that were received, whether or not there was a prior relationship with the suspect, whether or not the victim is on birth control, and their level of support that they have and their capacity to cope. We have to actively look and listen to the patient, speak directly to that person, not the interpreter or the guardian who may be in the room with them. All focus should be on the victim. They should address their fears, such as safety, pregnancy, sexually transmitted diseases, HIV infection, and respect their wishes, whether or not they want someone in the room with them, such as family during the exam, or who they want, to teach them, or what they do and do not want to discuss during the exam.
Collaboration. Collaboration encompasses the CERT team, which is the Sexual Assault Response Team. That includes the victim advocate, the forensic examiner, the law enforcement, the attorney, forensic science, and social services. All of these people come together to provide support for the victim during a rape situation. The skills necessary for the SANE nurse is communication skills, speaking and listening. Being able to listen and empathize with the patient is important. One of the skills in the interviewing the victim is to actually listen and look, to adapt to what that patient is going through and expressing. Also, the assessment skills, just gathering the right information, jotting it down as far as the diagrams of different injuries, scratches, wounds, anything like that. The knowledge of anatomy is important to documentation. Also, the physical exam is very important for this nurse.
With regards to evidence collection, it is very important for the nurse to have skills in photography techniques. Also important for them to have skills in how to properly use a colposcope to magnify the examination. They also need skills in evidence collection with regards to swabbing, traction of the area, and using the proper dye to fixate the evidence collected. Photo documentation skills definitely are important. The nurse needs to be able to properly and thoroughly take pictures of all injuries on all surfaces of a sexual assault victim's body to document that properly. Documentation skills, strong skills are also important written-wise, and properly diagramming injuries on the proper diagram. Chain of custody skills are very important. They need to be able to preserve and package the evidence that is collected and complete that chain of custody.
The interesting facts that we learned in this group project was the benefits for the SANE nurse in the community is to help with law enforcement with detailed documentation, also for the being an expert witness for attorneys, and addressing any aspect of the physical exam and being able to interpret that for law enforcement to help seek relief for the victim. The reducing the excessive wait time in the waiting room with the same nurse, she can take care of the patient. The physician will have opportunity to go and take care of other patients in the emergency room while she does the interview as well as the physical exam. Many of the same programs are coordinated with the Crisis Rape Center, and that's because they help the patients help the nurse learn emotional comfort and support for the patient. It helps them to adapt to the patient's needs and the patient's wishes at that time. Also, any fears or concern, they can address that. One of my other topics was, what is the maximum time to do the exam, the SANE exam after assault? In most states, it's 72 hours. However, in some states like Massachusetts and West Virginia, it's 120 hours after the assault has occurred.
During my research, I discovered that although typically when one thinks of a sexual assault victim, they think of a female victim and a male perpetrator. However, it has been found that 1 in every 10 rape victims, unfortunately, are male. They could be on college campuses or victims of rape as a child by family members or by strangers. SANE's perceptions of their relationship with professionals who treat or interact with rape victims was also important to discover. The positive perceptions were that the communication is open with those that they coordinate and work with. Also, they were respected and appreciated as SANE nurses. However, there were also some negative perspectives involved, and those included beliefs that police treat the victims poorly. Also, advocates for the patient could overstep boundaries. Then there was also indication that sometimes the prosecutor will fail to properly prepare the sexual assault nurse if she is called into a case. There was also problems with questioning the exam that was performed by the sexual assault nurse, as well as the collection of the evidence. So those were definitely some negative perceptions that sexual assault nurses have dealt with in their profession. Lastly, from a male SANE perspective, I came across an article written by Peter Isert. He was a, excuse me, he was a male nurse that had shown interest and was very interested in becoming a sexual assault nurse, but did not find very much literature on the perspective of a male nurse within the sexual assault arena. So he talked with some of his colleagues, and they thought it would be gross that a male would want to be a sexual assault nurse, as well as female sexual assault patients may not want a male nurse touching them. However, he did pursue his passion and did become a sexual assault nurse. And he did not find that any of the female sexual assault patients for the first 3 years, up until the time he wrote the article, rejected him as a sexual assault nurse. Therefore, his experience was a good one, and hopefully we will see more male nurses within this area.
Thank you for listening to our presentation on the SANE nurse.